If you see a blood pressure of 214 over 122, what do you do first? Patient is complaining of severe headache, blurred vision, and he doesn't know where he is, so he is confused. This patient is 62 years old. When you see a very high blood pressure like this in a patient or in a case study, what are the cues you recognize? What will you do and how will you decide on what to do? Hello everyone, it's Nurse Mo from Rofem NCLEX Academy. Let's talk about hypertensive crisis, a highly critical and life-threatening condition that requires rapid recognition, accurate assessment, and timely intervention. We will discuss the two categories, hypertensive emergency and hypertensive urgency. Whether you are studying for the NCLEX or working at the bedside, it is very important for you to understand hypertensive crisis. What is hypertensive crisis? Hypertensive crisis is a life-threatening situation where blood pressure is severely elevated. We are talking about systolic blood pressure greater than 180 and or diastolic blood pressure greater than 120. However, what makes a hypertensive crisis highly significant in the clinical environment is not just the number. It is the presence or absence of acute target organ damage. That is what determines the classification and how the patient will be managed and treated. The patient in hypertensive crisis will require immediate medical intervention. Hypertensive crisis is classified into two, hypertensive emergency or hypertensive urgency. In hypertensive emergency, there is evidence of acute organ damage. However, in hypertensive urgency, there is no organ damage. As nurses, you need to take note of what is going on in a patient with hypertensive crisis because the numbers will alert you while the symptoms will determine if the case is an emergency. You need to know that. We will look at the two categories. Understanding the difference between the two of them is really important. Hypertensive urgency happens when blood pressure is severely elevated, but there is no sign of acute target organ damage. The patient may present with headache, anxiety, of course, and mild shortness of breath. But when we look at their diagnostic findings, there is no damage to their brain, their heart, kidneys, or their eyes. This condition does not require immediate IV medications. The patient will be observed and treated in the emergency department with oral antihypertensive medications to lower their blood pressure gradually. The blood pressure will be reduced very slowly over a period of 24 to 48 hours. After that, the patient is given instructions for them to follow up with their primary healthcare provider. Let's talk about hypertensive emergency. This one is life-threatening. Hypertensive emergency may happen if a patient stops taking their antihypertensive medication, or it may be secondary to another disease process. When blood pressure is very high like this, vital organs are in danger. Hypertensive emergency can lead to so many complications because elevated blood pressure can damage blood vessels, which will further increase the pressure. And as nurses, once you see a patient in this situation, you should know the question to ask yourself. The question is this: which organ is being affected right now? Is it their brain, the heart, their kidneys, or their eyes? If the brain is affected by the elevated blood pressure, you will see neurologic crisis, which is hypertensive encephalopathy. You will see signs and symptoms like headache, confusion, seizures, and signs of a stroke, which requires immediate intervention. If the heart is affected, the heart will continue to struggle to pump blood against an extremely elevated afterload. You will see signs and symptoms like chest pain, shortness of breath, and pulmonary edema. Eventually, client may develop myocardial infarction or heart failure. If the kidneys are affected, remember the kidneys are highly vascular. With this problem right here, the kidneys will not receive adequate blood supply. Think about it. What's that going to lead to? There will be decreased urine output and elevated creatinine because when perfusion drops, kidney injury can happen really quickly. If the eyes are affected, this is hypertensive retinopathy. Severely elevated blood pressure can cause damage to the retinal blood vessels. The result of this damage will include blurred vision or sudden blindness. The extremely elevated blood pressure can also damage the optic nerve, and that will lead to partial or complete loss of vision. In hypertensive emergency, blood pressure must be lowered immediately and carefully. Patient will be admitted to the ICU, and doctors will order intravenous medications to lower the blood pressure. Here is a great tip to always remember: treat the patient, not just the number. Let's talk about the causes and risk factors for hypertensive crisis. There are several factors that can lead to hypertensive crisis. When a person doesn't take their medications as directed, or they just suddenly stop taking their anti-hypertensive medications. Cocaine use can lead to this, and a patient with renal disease can end up in hypertensive crisis. Others are patients with pheochromocytoma and pregnancy-related hypertension. There are some patients who may be at higher risk, and these patients include those with chronic uncontrolled hypertension, people with kidney disease, and patients with cardiovascular disease. As nurses, when you come across patients with medication noncompliance, you need a patient-centered approach to identify underlying issues, and then you will provide specific instructions. Always assess medication history very carefully. Let's take a look at what the treatment plan will look like. As for the treatment of hypertensive emergency, blood pressure will be lowered very slowly. If blood pressure is lowered too quickly in this patient, they can develop complications like cerebral or myocardial ischemia. Controlled reduction is very important. So, patient will be admitted to the ICU, and they will be treated with IV emergency blood pressure medications. For example, labetalol, nicardipine, and nitroglycerin. The desired goal is for their blood pressure to be lowered to 160/100 over the first 2 hours. Hypertensive urgency will be treated gradually and safely with oral medications. Examples are ACE inhibitors, beta blockers, and calcium channel blockers. Nursing management is absolutely important. You must be attentive to your patient and be ready to take action that will promote safety. If you suspect hypertensive crisis, assess the patient's neurostatus. Is the patient confused? Do they have weakness, slurred speech, or severe headache? Check for cardiac symptoms. Ask about chest pain. Also assess respiratory status. Check oxygen saturation. Assess for shortness of breath, signs of pulmonary edema, and listen for crackles. Ask about vision changes and check their urine output. Acute kidney injury can develop very quickly if we don't do anything to prevent it. Blood pressure should be monitored every 5 to 15 minutes. Place the patient on continuous cardiac monitoring, strict intake and output, and watch for hypotension. Follow doctor's orders on medication adjustment. Assess the patient's modifiable and non-modifiable risk factors. This way, you can provide education to them on how to prevent cardiovascular diseases. Don't forget to document thoroughly. Document the blood pressure readings, medication timing and administration, and how the patient is responding to the treatment. Now that we have talked about hypertensive emergency and hypertensive urgency, let's get back to our patient. 62-year-old male who was brought to the clinic. Blood pressure is 214/122. He complains of severe headache, blurred vision, and he is confused. When you see a blood pressure that is highly elevated like this one, your first question should not be, what medication do I give? Your first question should be, which organs are being damaged right now? What are the cues you recognize? Let's take a look. Okay, for our patient, let's take a look at this question. Which findings are concerning? Like, which of the following findings should the nurse be concerned about? Select all that apply. Answer choice A, blood pressure of 214/122. B, severe headache, C, confusion, D, blurred vision, and E, heart rate of 88. Which of them are your choices? Correct answers are A, B, C, and D. This is the rationale. Severely elevated blood pressure combined with severe headache, confusion, and blurred vision is a medical emergency. These are neurologic symptoms and they indicate possible hypertensive encephalopathy, stroke, or severe cerebral edema. Heart rate of 88 beats per minute is within normal limits. In the NGN step 3, we generate solutions. So, for the same patient, I want you to take a look at this question. Which intervention is the priority? Answer choice A, administer oral ACE inhibitor. B, start IV antihypertensive medication. C, encourage deep breathing. And D, provide range of motion exercise. What do you think about this question? Which one of them will you select? Place your answer choice in the comment section. Thanks for watching and learning from this video. If you want a more NGN-focused NCLEX prep, our NCLEX prep courses will improve your critical thinking, application, and clinical judgment skills. If you are a repeat test taker, I have a course that is built specifically for you. And if you need remedial course, we are approved by the Florida Board of Nursing. Don't forget to like, share, and subscribe to this channel to stay updated. If you have any questions, you can place them in the comment section. See you next time.